I'm Chloe, and I did my fourth sports medicine project on ADHD and its effects. Introduction. What is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. It's a neurodevelopmental disorder with symptoms like difficulty focusing, hyperactivity, and impulsive behavior. It affects people of all ages. The importance of understanding ADHD consists of understanding that ADHD is crucial for recognizing its impacts on individuals. Recognizing ADHD is essential because it affects various aspects of an individual's life, including academic performance, work, and social interactions. Early identification and intervention can help manage symptoms, improve functioning, and enhance quality of life. Additionally, understanding ADHD can help reduce stigma and fosters a supportive environment for those affected. It is important to understand that many people of our population are affected by this disease. Types of ADHD. The first type is inattentive type. People with this type have trouble focusing on tasks and are often forgetful and get easily distracted by external stimuli. They might lose things frequently and struggle to follow through on instructions. The second type is hyperactive impulse. This type is characterized by excessive energy and restlessness. Individuals may find it hard to stay seated, talk excessively, and act without thinking, which can lead to impulsive decisions and actions. The third is the combined type. This type includes symptoms of both inattentive and hyperactive impulse types. Individuals with combined type ADHD exhibit behaviors for both categories, such as difficulty focusing and excessive energy. Symptoms include missing details and becoming distracted easily. People often overlook or miss small details, which can lead to mistakes. They get easily distracted by things around them, making it hard to stay on task. Trouble focusing on the task at hand. They find it challenging to maintain attention on tasks, especially if they require sustained mental effort. This can make completing assignments or projects very difficult. Becoming bored quickly. They might lose interest in tasks quickly, especially if they're repetitive or not immediately rewarding. This can lead to switching tasks frequently without finishing them. Difficulty learning or organizing new information. They struggle with taking new information and organizing it in a meaningful way, which can impact their ability to study or manage tasks. Diagnosis. Age of onset. Symptoms must appear before age 12. This criterion ensures that behaviors are part of the child's developmental history and not a solely reaction to recent events or stressors. Core symptoms. The diagnosis focuses on three main areas: inattention, hyperactivity, and impulsivity. Duration. Symptoms must persist for at least 6 months. This duration helps distinguish ADHD from short-term issues that might arise due to temporary circumstances. Impact. The symptoms must cause significant impairment in social, academic, or occupational functioning. This means they interfere with the individual's ability to perform daily tasks effectively. Assessment. A thorough assessment includes a clinical interview to gather a detailed history, behavioral questionnaires to quantify symptoms, report from teachers and parents to provide context across different settings, and direct observation to see the behaviors firsthand. Diagnosis. A healthcare professional, such as a psychologist or psychiatrist, makes the diagnosis after ruling out other conditions that could mimic ADHD, such as anxiety, depression, or learning disabilities. Causes and risk factors. Genetic factors. ADHD often runs in families, indicating a genetic link that increases the likelihood of developing the disorder. Environmental factors. Exposure to toxins such as lead or prenatal exposure to alcohol and tobacco can raise the risk of ADHD. Brain structure and function. Differences in the brain and activity in areas responsible for attention and impulse control are often seen in ADHD patients. Brain injuries, such as traumatic brain injuries, especially to the frontal lobe, can contribute to the development of ADHD symptoms. Premature birth. Being born prematurely or with low birth weight is associated with higher risk of developing ADHD later in life. Effects of ADHD. Academic performance is one struggle people with ADHD endure. Struggles with focus and organization can lead to lower grades. Social interactions. Impulsivity and difficulty with social cues can hinder friendships. Family life. Stress and conflicts can arise from the need for structured routines. Mental health. Higher risk of anxiety and depression affect those with ADHD because it lowers their self-esteem. Treatment and management. Medication options. Stimulants and non-stimulants both are capable of improving focus and impulse control for those with ADHD. Behavioral therapy. Behavioral therapy teaches coping skills and behavior management. Lifestyle changes and strategies. Exercise, diet, and sleep and routines support symptom control for those with ADHD. Support systems and resources. Educational support and therapy help manage challenges for those with ADHD. This can include friends, family, or people at their school, or just having any social support systems around them. And that can be really helpful and has been proven to be one of the most successful treatment for those with ADHD. Thank you.